Poodles are renowned for their elegance, intelligence, and overall good health. However, like all breeds, poodles are susceptible to certain genetic health conditions that may require early detection and management. As a responsible poodle owner, understanding the specific health screenings and tests recommended for your poodle can help ensure their long-term health and well-being. In this comprehensive guide, we'll explore the poodle's specific health screenings and tests you should consider for your furry companion. Hip dysplasia is a common orthopedic condition that affects many dog breeds, including poodles. It occurs when the hip joint doesn't develop properly, leading to instability and degeneration of the joint over time. To screen for hip dysplasia, veterinarians often perform a diagnostic test called the Orthopedic Foundation for Animals (OFA) hip evaluation. This involves taking X-rays of the hips to assess their structure and detect any signs of dysplasia. Screening for hip dysplasia is especially important for standard and miniature poodles, as they are more prone to this condition than toy poodles. Poodles are susceptible to several hereditary eye conditions, including progressive retinal atrophy, PRA, cataracts, and retinal dysplasia. Regular eye examinations by a board-certified veterinary ophthalmologist can help detect these conditions early and prevent vision loss. During the examination, the ophthalmologist will evaluate your poodle's eyes for abnormalities, perform specialized tests such as electroretinography, ERG, and provide recommendations for managing any diagnosed conditions. Progressive retinal atrophy, PRA, is a degenerative eye disease that eventually leads to blindness in affected dogs. PRA is known to occur in poodles, particularly standard and miniature varieties. Genetic testing is available to identify dogs carrying the gene mutations associated with PRA, allowing breeders to make informed breeding decisions and poodle owners to assess their dog's risk of developing the disease. Early identification of PRA carriers can help prevent the spread of the disease within the poodle population. Von Willebrand's disease, VWD, is a hereditary bleeding disorder that affects the blood's ability to clot properly. Poodles, especially standard and miniature varieties, are among the breeds predisposed to VWD. Genetic testing can identify dogs carrying the gene mutation responsible for VWD, enabling breeders to avoid breeding affected individuals and reduce the prevalence of the disease in the poodle population. Testing for VWD is particularly important for poodles undergoing surgical procedures or dental cleanings, as they may be at increased risk of bleeding complications. In addition to PRA and VWD, poodles may be susceptible to other genetic disorders, such as sebaceous adenitis, Addison's disease, and epilepsy. DNA testing is available for many of these conditions, allowing breeders and owners to identify carriers and affected individuals. By screening for genetic disorders early and making informed breeding decisions, we can work towards reducing the prevalence of these conditions in the poodle population and promoting overall health and longevity. Thank you for watching Dog Linked channel. Please subscribe, comment, like, and share.